Hello, I'm Gwyn Barley, the director of the University of Colorado's Center for Advancing Professional Excellence, or the CAPE. The CAPE was launched in 1998 and moved here to the new Anschutz Medical Campus in Aurora, Colorado in 2007. The CAPE is comprised of 18,000 square feet of space on the 4th floor of an education building on the Anschutz Medical Campus.
Who's getting the report?
I am.
Great. Got an 8-year-old female, restrained front seat passenger of a car, T-boned to the passenger side by a pickup truck at a high rate of speed.
What drove me to get into medicine? I just had a great family doctor. It was really fun to go to his office. Sometimes I think I'd probably make up some reasons just to go, and I could sit there and talk to him, and it was just a great bonding process. Today what's happening, we have a multidisciplinary group in training to do scenarios, and we can look at their interactions and their communication skills.
We're going to take her off this board.
I'm actually planning on going into emergency medicine, and the thing I really like about it is you can take somebody's emergency, someone's scary situation, and really help them out with it. And whether the scary situation seems scary to me or not, it doesn't really matter. If they're having an anxiety attack, if they're having something pretty benign going on, but they're feeling worried about it, I can really help them out with that.
The airbag did deploy.
These are actually pretty cool little mannequins. They have pulses, they have breath sounds, all that. So I think it's helpful, especially when you're starting out and you don't get to be at the head of the bed and doing everything because you're going to mess up. You can mess up on the mannequin.
The CAPE features one fully functional apartment. We have 15 fully functioning outpatient exam rooms. The CAPE also has 3 consult rooms. The CAPE brings together a state-of-the-art, all-encompassing learning and assessment center that doesn't exist anywhere else in this region.
Today we have an assessment going on where all the first-year medical students are being assessed on their physical exam skills. This control room is very state-of-the-art. In the center alone, we house 10 terabytes of space, and it's all pretty much controlled right here. What's most exciting for me is being part of a really successful center that puts on an all-encompassing exam or learning experiences for the students and helps them in their medical education to be the best clinicians that they can be.
We're going to break it down.
We care passionately about the SPs and TAs being successful, and that means that they have to know the material.
Today we're going to go over 3 exam systems: cardiovascular, pulmonary, and abdominal. The purpose of our trainings is to be as hands-on as possible.
Being a SPETA is a really incredible experience. Not only is it a huge education and learning curve for us, but we learn a lot about our bodies, and I want to make a difference. I really feel like I make a difference here.
I want them to go through the physicality of practicing. A successful training is everybody feeling like they're in a good space. They're ready to go for their teaching session.
You're going to get a nice sound.
The Teaching Associate Program is a wonderful program. These are lay clinical educators who teach the physical exam in a highly standardized and fully competent way to many of our health professional students.
The pain might not just be right there.
Today we spent the morning and we'll spend the afternoon working with first-year med students on abdominal exams.
We practiced the different signs to look for like appendicitis and gallbladder ailments and just general palpation and general physical exam of the abdomen.
The skills that they learn here are just so much better practicing on a real person, a person that they can actually practice on and learn from and make mistakes on before they get out there and practice on real patients, because of course we don't want them practicing on real patients. We want them to know what they're doing when they go out there.
You got varicose veins.
Here at the CAPE, having a UTA program has assured that all of our students and learners are getting these important examination skills.
Today we performed the male urogenital exam, and it was a really great experience. It was a low pressure learning situation where they standardized patients sort of ran us through the exam and taught us and showed us, gave us tips on how to make the patient more comfortable and how to refine our technique.
Yeah, choices of words in this exam become very interesting. I've always kind of liked the capacity of teaching, being in the role of an instructor. It kind of fits me naturally.
Communication with patients and families and team members is the most important, number one, core skill that any healthcare clinician is going to have for their life.
What do you know about it?
So today we have second-year medical students that are working on communication skills, a very specific set of skills around behavioral modification.
And I saw Sarah, who was a smoker and was coming in repeatedly with chronic bronchitis, and we were talking about her willingness to stop smoking and her ability to stop smoking if she is willing. I think it did a pretty good job of using empathic statements.
You definitely showed empathy and gave me a chance to tell you my story as a patient.
People really need to be satisfied with their doctors, and if their doctors listen and they allow that patient to be in the center of that interview, it's really going to make a huge impact on medicine. I like that last part about your family and demands.
The art of medicine, connecting with people, is still incredibly important, and I think that we teach students how to do that very well.
Our simulation program at the Cape is a natural extension and partner to our standardized patient and TA programs. In our simulation program, we can create patient scenarios that our SPs and TAs can't create, and we can do things to a simulator that we can't do to our live employees.
Today here in the Cape, we're going to be using Noel, which is a high-fidelity simulator, to simulate a vaginal delivery.
You guys have been called in because a nurse feels that the patient is going to deliver.
The great thing about Noel is you can speed up the process or slow it down, and so when there's more questions, we can stop the actual delivery and discuss different steps, which I think the students really appreciate, being in a less chaotic environment.
And remember, these kids are very slippery. Amniotic fluid is slippery. So you have to have a good purchase on this child. You don't. I think all of us are teachers in some way, but the only thing I have to pass on to others and to students is my knowledge and my experience.
Powder in your pocket, do you know what that is?
The future of the Cape is very bright. We represent leadership in medical education and in educational assessment. And as we go forward into a new day where we have much more personalized education and deeper education around the core competencies and ongoing education, our role is pivotal in the success of this university and this region in making those dreams really come to fruition.